Autism Spectrum Disorder (ASD) is a neurodevelopmental disorder characterized by persistent deficits in social communication and social interaction, as well as restricted, repetitive patterns of behavior, interests, or activities. Here's a detailed explanation of autism spectrum disorder, including the DSM-5-TR criteria. Persistent deficits in social communication and social interaction, social emotional reciprocity. Difficulty in social reciprocity, such as initiating and maintaining conversations. Challenges in sharing interests, emotions, or activities with others. Nonverbal communication, deficits in nonverbal communication, including gestures, facial expressions, and body language. Developing and maintaining relationships, difficulty in developing and maintaining relationships appropriate to developmental levels. Restricted, repetitive patterns of behavior, interests, or activities, stereotyped repetitive motor movements, use of objects or speech, repetitive movements, echolalia, or use of objects in a ritualistic manner. Insistence on sameness, resistance to change, strict adherence to routines or rituals. Highly restricted interest, intensive focus on specific interests, often to the exclusion of other activities. Hyper or hypo-reactivity to sensory input, overreactivity or underreactivity to sensory stimuli, such as sound, light, or textures. Symptoms must be present in early childhood. Symptoms typically become apparent in early childhood, impacting daily functioning. Clinically significant impairment in social, occupational, or other important areas of functioning. The symptoms significantly impact the individual's ability to function in social, academic, or occupational settings. Not better explained by intellectual disability or global developmental delay. The symptoms cannot be solely attributed to intellectual disability or global developmental delay. Severity levels. ASD is further classified based on severity levels: Level 1, Level 2, Level 3. Considering the amount of support required for social communication and restricted, repetitive behaviors. Additional consideration specifiers. The DSM-5-TR introduces specifiers to characterize additional features like intellectual impairment, language impairment, or associated medical or genetic conditions. Early intervention and support. Early diagnosis and intervention, often involving behavioral therapy and tailored educational strategies, can significantly improve outcomes for individuals with ASD. Understanding and recognizing the diverse presentation of ASD is crucial for early identification and intervention. It's important to note that ASD is a spectrum, and individuals may vary widely in their strengths and challenges.